to the Western Australian environment and starting to certainly enjoy it over there. There's a lot of beach in Western Australia. The coast goes for about 10,000 kilometres or something, and it's a nice place to swim, but there's a lot of sharks as well. So if you do go for a swim, just be careful. Maybe swim before you've had lunch or something. So the outline I wanted to go through today, there's quite a bit to get through. The early part of it I will move fairly quickly because some of it might be a little bit of a revision. There will be a little bit of technical stuff in here, but bear with me, I'll try and explain everything as best I can. And at any time if you have a question, please feel free to ask me. So first of all, I just want to give an overview, if you like, of exercise. It's integrative physiology. It's one of the most integrative things we do. Even just walking around engages our nervous system, our cardiovascular system, our muscles. It's good for our hormonal balance, all those kind of things. And so it's very hard when we think about training someone that we're training a muscle group, or we want to get stronger, faster, jump more, do whatever we do, because we're influencing all the systems of the body. Then I'll talk about what we know happens in the muscle. So when we train muscle, it adapts and it becomes very good at what we've trained it to do. I'll then talk a little bit about what happens in the heart, because the heart changes as well. Even if we're training the muscle, we are actually influencing the heart. Some of it's good. There is potential that we could actually be damaging the heart. Very minor chance that we could be doing things that maybe we don't want to be doing to our hearts. I'll introduce this concept of ventricular mechanics and using echocardiography to look at how the heart actually functions, both at rest and during exercise. And I'll talk about the studies we did, a series of studies I did just before I left Griffith University to move to Curtin, where we were looking at these cardiac responses to acute exercise and seeing that a single bout of exercise can actually cause cardiac fatigue and what the consequences of that might be. And then we'll have a little summary at the end. This is a really busy slide. There's a lot going on here. I put it together. I was asked to do a one-slide presentation to a new group we formed in Western Australia called an Environmental Physiology Special Interest Group. And this group is looking at things such as hypoxia, heat, ischemic preconditioning, all these things to enhance muscle performance. The group includes people from the West Australian Institute of Sport and the 4 other universities in Western Australia. That's University of Western Australia, Murdoch University, Edith Cowan University. And I was sort of just saying my research focused really on the muscle. Then I got very interested in how the muscle talks to the heart. And ultimately, and this is what I'm going to be talking about today, what actually happens to the heart when we're exercising. Because just to jump forward a little bit, strenuous exercise does cause transient changes in our cardiac function. The heart gets tired and it can't work the way it did before exercise.